Please go ahead, Nandita.
Great. Good morning, good afternoon, and good evening. Welcome to today's webinar hosted by the IBP Network in partnership with WHO, UNFPA, IPPF, and Jhpiego. My name is Nandita Tate, and I lead the IBP Network housed at WHO in Geneva, Switzerland, and I will be your moderator today. The COVID-19 pandemic continues to impact most of the world, with over 1 million cases and close to 70,000 deaths worldwide. At the same time, we know that it is important to support the continuation of essential health services to further improve the health outcomes and lives of so many around the world. Today's webinar will focus on the implications of COVID-19 on family planning services. Before I go over the agenda, I want to take a moment to recognize all the essential professional workers out there supporting communities around the world. Educators, food service professionals, maintenance staff, and others. Your work is invaluable. I also want to specially recognize and thank the world's health workers. This week is Global Health Worker Week, and WHO has designated 2020 as the Year of the Nurse and Midwife. The dedication and commitment of these healthcare professionals around the world is truly inspiring, and we thank you for your continued service. Next. And next, our agenda today will start with remarks from James Kiarie from WHO on the response and some specific guidance on contraceptive services. We will then hear from Ben Light from UNFPA on how COVID has impacted commodities and supply chains. Next, we will hear a regional and a country perspective. First, Tomoko Fukuda from IPPF, Regional Office Asia, will share experience from the Asia region. And then we will hear from Dr. Yolande Hyjazi, who will share lessons we can learn from the Ebola experience in Guinea. Finally, I will turn it over to Ricky Liu, who will provide some reflections and lead us through some question and answers. Next. A few housekeeping things before we begin. Please note that the webinar will be recorded and will be available on the link that you see there. We have close to 2,000 people that registered for this webinar, and there are some that will not be able to attend live. So please note that it will be recorded and you will be receiving a link to the recording after the webinar. Also, please make sure to submit your questions. You can do that using the control panel on the right side of your screen. We will be collecting questions throughout the presentations, and then my colleague Ricky Liu will use those to help moderate the discussion. And finally, please remember to download the handouts. We have put some important handouts on the control panel on the right, including some of the WHO guidance for essential health services and some other resources. Next. With that, I would like to introduce our first presenter, Dr. James Kiarie. He is the head of the Contraception and Fertility Care Unit at WHO in the Department of Sexual and Reproductive Health and Research. James, I turn it over to you.
Yeah, thank you very much, Nandita and ADOS and colleagues for inviting me to make this presentation on behalf of both WHO and the Human Reproduction Program, which we work for. And I will focus my presentation on looking at what WHO is doing broadly in the area of COVID and look at some guidance, specifically in terms of contraception, some of the technical support we are providing, and then look at some of the research ideas that we have. So on the next slide, if you are to go to the WHO page on COVID pandemic, it kind of highlights how WHO is responding to the pandemic. And one, I think there's a big, and this probably has been done for the first time, where there's significant public facing documents, kind of to advise the general public. There's advice for the public, there are press briefings, and there's quite an extensive question and answer documents that are targeting the public and which you can refer to generally on the COVID, and I'll also be referring to some that are very specific to family planning. There's also technical guidance targeting countries, issues of travel, and there are some detailed situation reports detailing the pandemic and with details of each of the country and how the situation is evolving. And also the specific research tools and resources. There is a database of all publications on the COVID-19 pandemic. There is a global research roadmap that WHO has developed to kind of try to guide the research that needs to be done during this period that we are in. And also the International Clinical Trials Registry platform, which is an old WHO platform, is of course available for people to register any of the clinical trials they are doing in this area. And then the Solidarity Clinical Trial for COVID-19 treatment. If you want more information, you can go to that website. And on the next slide, I think if we look, and this slide shows a map which I looked at when I was reviewing the WHO homepage. And if you look at that kind of the dashboard, on the dashboard on the WHO COVID homepage, they have this dashboard that shows a map of all the countries with the distribution of the pandemic, and really just shows how extensive and how rapidly this pandemic spread and how widespread really the impact has been. So as Nandita has said, we really like to remember all those who are facing challenges due to the pandemic and those who are supporting the response in various ways. On this page also, you'll find some of the guidance that WHO has issued, kind of overarching guidelines. I would really like to highlight the operational planning guidelines to support clinical country preparedness and response, because these are the operational guidelines. And as we think about contraception specifically, we'll be drawing on these operational planning guidelines. And these guidelines have 8 pillars that are important for country preparedness and response. And on this slide, I just highlight 5, which I think are important. If you have a chance to review that guideline, it can be found on that page. You can be able to see the 8 pillars and read more about these 5 pillars, which are really very important for family planning. And on the next slide, drawing from the operational planning guidelines to support country preparedness and response, WHO has actually developed a specific guideline that is focusing on essential services. So next slide. So this is the operational guidance for maintaining essential health services during an outbreak. And this is drawn on what I've talked about, the operational guidelines on country preparedness and response. And just go back one slide. So this guideline on maintaining essential services, it looks at all essential services, and it is identified 7 essential services. And based on these essential services that have been identified, one of the essential services is sexual and reproductive health. And based on this, as our department, the Department of Sexual Reproductive Health and Research, we are developing a briefing note titled Protecting Rights to Essential Reproductive Health Services during the COVID-19 pandemic. So this kind of drills more deeply into the issues specific to sexual reproductive health services, and I'll be talking a bit more about that guidance. And then drawing upon these sexual reproductive health services briefing note, we are now developing a contraception, family planning, and COVID-19 question and answer that addresses various questions that are specific for family planning services during this period. So on the next slide, just to kind of orient you to the operational guidance for maintaining essential health services during the outbreak, it has around 6 areas that it focuses on, but some are particularly important for us in family planning. And so you can see one of the areas, and really this guidance is about balancing the demands, both of responding directly to the pandemic while maintaining essential health service delivery and also mitigating the risk of system collapse. I mean, it is very clear that not all services can be maintained as the health system orients itself to response to the pandemic, but there are essential services that must continue to be provided. So the first aspect is, of course, to identify what are the essential services. And I said that sexual reproductive health, including maternal and child health, have been identified as essential services, and also identifying services that can be delayed or relocated, and then having a roadmap for the progressive phased reduction of service depending on the stage of the pandemic, and other documents outline the various stages of the pandemic. And then it discusses about how to optimize service delivery settings and platforms. I think it would be naive for us to imagine that contraception services will be provided in the same way during the pandemic as they are being provided now. We must find ways to look at how to maintain supply chains, and it's good that we have somebody who is speaking more about the commodities and supply chains. That will be very important at this time, looking what health facilities are used and for what, and what outreach mechanisms can be used. And then the issue of the health workforce. There's a lot of redistribution of health workforce that is already happening, and we need to be able to map the health worker requirements. What will we need to maintain the essential service of contraception, and what can we then reallocate to the COVID response? And also, as people continue to provide services, even if not directly to patients, it's important to maximize the staff safety measures. On the next slide, I highlight some of the things that are covered in the briefing note on the protecting rights to essential reproductive health services during the COVID-19 pandemic. And importantly, these briefing notes highlights the several WHO recommendations and options that are available for us to optimize service delivery settings and platforms. And these, just to highlight a few, include our task sharing guidelines, our digital health interventions, and the self-care guidelines. This will be very critical as we try to sustain and maintain these contraception services, looking both at the aspect of the health workforce, the medications, the equipment, and the supplies. And then on the next slide, I look at the kind of listing of the questions that are addressed in the Q&A session. I will not try to go through all the questions because you'll have these, I hope, will be put on the WHO website later today or tomorrow. And they address various concerns both individuals, providers may have during this period, and how they can try to address them, and what are the options that they can be able to use. But importantly, at the bottom of the slide, I highlight some of the issues which we target the Q&A to policymakers, what they can do to ensure contraceptive and family planning access, and also for program managers, how they can help people to access services. How can they leverage some of these unique platforms and options that will be available during this period. And I must say that talking to many of the country colleagues, countries are being very innovative in trying to maintain contraceptive services. And I must really applaud the colleagues in country who have been very, very innovative in making sure that the services continue. And then on the second last slide, which is the next slide, just to highlight that beyond this guidance, we are having various approaches by which we are supporting the countries, providing technical support. One of the areas, and WHO is available for those country colleagues who are working on development of national guidelines and protocols. You can reach out to the country offices, to the regional offices, and even to us in headquarters, and we are able to give you input and support you in the development of national guidelines and protocols that will be important for you to sustain contraceptive services. We are also doing training and capacity building, and we'll be planning some virtual trainings for country colleagues to orient them to the guidance and to kind of share some of the things that we have learned with our interactions from different countries. I think what we can do well, and particularly through the IBP network, is this sharing of practices and experiences. I think they are very innovative practices that the countries are employing, and it is this period, because of the emergency nature of the response, is a time that we can really leverage our networks to be able to share these practices and experiences of what is working, so that we do not have a reinvention of the wheel happening in each country. Of course, for WHO, one of the things that is happening is that a lot of staff are being volunteered to participate directly in the response. In our own department, we have several staff that have been detailed to regional offices, to country offices to support the response. And a lot of the national officers are also being detailed to the Ministry of Health to support the response. And then on the final slide, I would just like to highlight some of the research that we are undertaking. A lot of the research, of course, is a documentation process. This is not a priority, but it will be important for us to learn lessons, because the reality is that situations like this are likely to arise again in the future. We can learn from them and be better prepared. The first is a protocol that is started to be developed, looking at the impact of COVID-19 pandemic on sexual reproductive health systems using a social science approach, specifically to see the barriers to access and availability of services and utilization, and both looking at abortion and post-abortion services. And then having a qualitative research on women's reproductive and psychosocial health in the context of COVID-19. This is has moved and has been submitted to the Health Emergency Research Team and is being considered for implementation in the countries. The second one is an idea which I think we, with various partners, can develop, but it is based on this idea that we need to have to really learn from each other. And there are various national responses, that we are seeing on how to maintain sexual reproductive health and rights services in the context of the COVID pandemic. But which ones of these responses are being successful, and what are some of the predictors that will be of this success? So for this, it will be important for us to document these efforts, both at national level and programmatic level, and assess their impact on the continued uptake and use of sexual reproductive health and reproductive services, and then follow up with qualitative studies to identify why some of the responses were effective and what are the reasons for success. So this is an idea that we are kind of grappling with as to the best way to move forward, but I just wanted to put it out there so that we can share ideas on how to move forward. So finally, I thank you very much for your kind attention, and you can follow us on Twitter at HRP Research, and a lot of these documents will also be available at our departmental website, which is highlighted there. So thank you very much, and back to you, Nandita.
Great. Thank you very much, James. That was a great overview and great to hear all the resources available at WHO for the public to access, and also to hear about the efforts around sexual and reproductive health, both to ensure essential services, but also make information available in easy to understand formats, and of course, hearing more about the research agenda around this issue. Thank you very much. Our next presenter, Ben Light, is actually having a little bit of trouble connecting. So I think what I will propose is that we move to our next presenter, Tomoko Fukuda, from the IPPF Regional Office in East and Southeast Asia region. Ms. Tomoko is, as I mentioned, the regional director and responsible for leadership and management of the work of IPPF in the region, supporting 22 member associations and 3 collaborating partners in a total of 25 countries.
Tomoko, go ahead, please.
Okay. Thank you for the introduction, Nandita. My name is Tomoko. I'm the Regional Director for IPPS, which is the International Planned Parenthood Federation for East and Southeast Asia and Oceania region. And thank you so much for the opportunity to share what's happening with regards to COVID-19 in our region. Next, please. So IPPF is a bit unique in that we are a federation of member associations in countries. So as introduced, we have 22 member associations and 3 collaborative partners across 25 countries in the map that you see there. It means that member associations means a local non-government organization that is rooted in each of these countries. And each of these member associations have service delivery points. So totaling them, we have 7,881 service delivery points. Next, please. IPPF member associations provide services around SRHR in terms of what we call the integrated package of essential services. It includes things like gender-based violence counseling, of course, contraception and obstetrics, safe abortion, STIs and HIV, and gynecology like cervical cancer. So they provide a wide range of SRHR services. Next, please. Just to give you an idea of the scale of how the member associations provide SRHR services in this region. The number of SRHR services provided in 2019 is 20.2 million. It's estimated that we reached about 6.1 million clients in all of these 25 countries, and about half, or 68% of these, were poor and vulnerable clients. And you see the wide range of services provided here. The service delivery network is mainly from static clinics, but we also have mobile outreach clinics. Also, community-based distributors play a big part in providing services to the people. Next, please. So today, with the time that has been given to me, I'd like to share with you how COVID-19 is impacting SRHR services being provided by our member associations. We recently did a survey with them, and the results are being processed right now. So these are just the indicative results. But as of March 31st, the MAs responded that 74 of the static clinics have had to close, as well as 46 mobile clinics and 20 associated health facilities. So 74 static clinics and 46 mobile clinics are about like 19 to 21% of all the service delivery points. Only 90 community-based distribution points had to be closed, which is only 1.3%. So it shows that at the community level, they have not had to close yet so far. So this is the kind of the impact that we've seen so far. But most MAs reported that they've had to scale down the availability of services, either by decreasing the hours that they are opened. Of course, they have to close down on some of the clinics or mobile clinics, as mentioned earlier. And also, they have had to reduce the number of working health service providers to decrease the risk. The availability of protective equipment, personal protective equipment, is also an issue. Also, if they have health staff who are higher than a certain age, they would be asked to stay at home so as not to increase the risk of contacting COVID-19. So it has impacted the MAs by having to scale down the availability of services. Next, please. So far, 12 MAs have reported commodity shortages, including contraceptives, safe abortion and medical abortion supplies, and pregnancy test kits. One MA in Kiarie actually has reported that they have had to suspend or ask 7 of their staffs to stay at home. And one MA, which is the Philippines, has dedicated health facility space to test and manage COVID-19 as part of the national response. So they are providing their services for the COVID-19 response. A lot of the MAs have reported that there's a steep decline in face-to-face trainings, education sessions, outreach health education. All of this are having to be put on hold right now. What we are seeing at the impact actually is that not from the infectious disease per se, but more with regards to the lockdowns that the countries are imposing. So countries have a varying degree of mobility restriction orders. Some are more strict than others, but most of the countries have asked people to stay at home. Some of the countries have put in very strict measures for businesses to close down. So this lockdown order actually is what is impacting the health service providers more, is what we are seeing right now. Next, please. But within these difficult circumstances, the MAs are still trying to keep their clinics open and be there to be able to deliver SRHR services to the people as much as possible. They are being creative and adapting to the situation, such as by reducing opening hours, operating with limited health service providers with protective measures in place, like taking temperatures, using masks, or asking the clients also to use masks. They have also For example, if there were clients that were interested in the IUD, ask them if they would be willing to go on the pill for a few months while this is happening, so that they can still have access to services, but not in the form that they desired initially. But and then there are 4 MAs that are providing a range of services and clinical consultations via telemedicine. So that is already happening in countries like Australia, China, New Zealand, and the Philippines. 3 of the MAs from China, Philippines, and Malaysia have reported that they are offering home delivery or doorstep delivery of SRH products like contraceptives and pregnancy test kits. Many of the MAs have said they are using more the digital communication media, such as using social media, web-based chat consultations, telephones, WhatsApp, to try to provide health education or provide counseling with regards to SRH at this time. So they are trying to find different ways that they can still continue to provide services at this time. Next. So from all of this, what are some of the key things that we have learned and some of the things that we need to think of as we go forward? One of the first things that I would like to say to you is that we need to really consider the gender perspective in family planning access. This lockdown has brought about a situation that we have never encountered before. And when women as primary health givers are in the home with the whole family, and if they have to provide support to the whole family, maybe including parents, maybe including brothers and sisters, extended family, of course, they have to provide their whole time to this, and her health care becomes of less and less priority. We already know that cases of gender-based violences will go up. And when you are in lockdown and you are not allowed to leave the house so often, but if you are even allowed to leave the house once in a while, perhaps if decision making is done by the husband, for example, it might be difficult to leave the house for an SRH service, even if it was allowed to do so by law. So this lockdown has brought about a situation in terms of gender that brings about several different layers of barriers to women in accessing family planning at this time. And we also know very now that this will impact economy. Household income will go down. And of course, if there are other competing priorities in the family, access to family planning services will definitely go down, and priority of that will go down. So considering the gender perspective of family planning accesses will be key for us to find ways in which we reach the women during this time, and also perhaps messages in our communication to the households, to the families, have to take this into consideration. Another key message that I would like to say is to be agile, adaptive, and innovative. The first speaker also said, there are people at the country level are being innovative. We see that also. Launching new ways to deliver family planning information and services, making use of digital technology. I would just like to add that in all of this, it's great, and I think it's a kind of an opportunity that has brought about new ways of thinking, and I think we should embrace that, and it is a time for us to make changes. But we also don't want to leave anyone behind in all of our endeavors. So we know that refugees, migrants, the poor, the vulnerable, people with disabilities, LGBTQI, these are people who could be easily left behind in new ways that emerge. So I would urge people to be agile and adaptive and innovative, but take care so that we don't leave no one behind. And my third point would be to urge people to invest in people and institutions at this time. What I mean to say is that the income of health service providers will decrease. That may jeopardize some of the clinics, if they are private clinics, to be able to be sustainable and throughout this crisis. And perhaps at the end of this pandemic, we will have no private clinics left standing if they are not able to support the personnel. So we are already seeing that kind of trend where health service providers are asked to leave and take leave and stay at home because they fear that they won't be able to sustain their clinics. So donor funds at this time, in IPPF also, we are asking our donors if some of the fundings that we are receiving could be rerouted into supporting personnel and operations costs at this time so that FP service delivery points can still exist. Even with perhaps project funding that was already approved. With all the lockdowns in place, business as usual is not going to happen. Projects cannot go forward in the usual way that it was planned. So why not reroute these project budgets into something that will support the health service delivery on the ground in times of COVID-19? So these are the messages that I would like to share with you today. Thank you very much.
Great. Thank you very much, Tomoko, for a very inspiring presentation. Clearly, a lot of work has been done in the region, and we really appreciate all your efforts and the lessons learned for the rest of us moving forward. I would like to now go back to our presenter, Ben Light from UNFPA. Ben has worked at UNFPA since 2004. He is a senior policy advisor for family planning and reproductive health commodity security. And he will be talking about the impact of COVID-19 on commodities. Ben, I turn it over to you.
Hi, Nandita, am I coming through loud and clear? Can you hear me?
Yes, please go ahead,
Yes.
Ben. Thank you.
Great.
Very clear.
Thank you.
Go ahead.
My apologies, everybody on the call. Okay, moving. I've got three slides that I wanted to walk you through. The first one is a global overview. So, obviously, as I think you'll all know, reproductive health supplies, contraceptives and maternal health medicines are crucial to the work that UNFPA does to support governments and are needed to ensure services and choice and to sustain them over time. As the world's largest procurer of donated contraceptives, UNFPA is committed to ensuring that essential supplies reach the needy, with a special focus on marginalized and vulnerable women and adolescent girls. In the face of COVID-19, family planning supplies and services remain vital to the health and well-being of millions. UNFPA, through the Copenhagen-based UNFPA Procurement Service, procures quality-assured contraceptives that meet internationally recognized quality standards, and these are predominantly products qualified by WHO. UNFPA is currently taking administrative measures to expedite procurement, but increasingly, as we're increasingly aware, the pandemic is beginning to strain global supply chains. communication with suppliers and manufacturers has increased, but we're facing many challenges with sourcing of products, procuring, freighting, and delivery. And these are stretching timelines and causing severe price fluctuations, generally upwards. Moving on to the next slide. Procurement specifics, and this information was accurate as of March the 31st. That was Tuesday of last week, and things have moved forward since then. Firstly, I will talk about hormonal contraceptives, and I just wanted to make clear that in all this presentation, the skew of what I'm covering is really towards contraceptives per se. We provide support and donations of contraceptives and maternal health, key maternal health medicines, but the focus here is very much on contraceptives. So first of all, hormonals, orals, emergency contraception, implants and injectables. Currently, UNFPA is able to source from 3 geographical regions, and the situation in each is as follows. In India, there is a nationwide shutdown of production until the 14th of April, and where there are a number of limited exceptions, there are also restrictions being faced at ports and airports. In Indonesia, shipping is continuing according to a schedule that was agreed prior to the COVID-19 crisis. It's envisaged that production may suffer if the crisis endures, where active pharmaceutical ingredients are sourced from Europe. These products, UNFPA, just for your information, there's currently a 3-month of stock, so the situation isn't yet absolutely critical. Those products that are sourced from within Europe, the supplies manufacturing is at full capacity, although pricing, sourcing, packaging and shipping challenges are anticipated, and that they will run into the second half of 2020. Turning away from hormonal contraceptives, and first of all taking female condoms, UNFPA has a limited number of sources from which we're able to procure. The India suppliers are affected by the shutdown that I mentioned, and a supplier based in Malaysia is facing restrictions, and currently there's no pre-shipment inspections, so we're dealing with unfamiliar situations on an ongoing basis. And certainly with regard to the procurement, sourcing, delivery of female condoms, as with orals, emergency contraception, implants and injectables, delays are very much expected. Turning to the male condom, the Thailand production seems to be holding, and this is ensuring a certain level of supply. In China, there is the start of return to normal. In Malaysia, as has been very much covered in the international press, factory closures are constraining UNFPA procurement as well. And the Indian based manufacturers face these ongoing nationwide shutdown. So delays are certainly expected. In the area of the intrauterine device, IUDs, all UNFPA available resources are India-based and so subject to the constraints of the shutdown, and existing orders are blocked due to port and airport restrictions. Currently, UNFPA is not in a position to supply IUDs. Then turning to a slightly different issue, the issue of delivery challenges. Freight forwarders at the international level are facing a highly volatile market, with prices changing as often as hourly as capacity expands and contracts. Surcharges are also noted on road freight within Europe and sea freight from Europe to Asia and the US. All of this conspires to result in longer lead times and increased prices. Moving on to the final slide, this focuses on in-country challenges. If we could have the, yes, thanks. Again, this information is as of 31st of March, but you'll see that this is relatively less time sensitive. On the left-hand side, you'll see the familiar words: no product, no service, no product, no program, etc. Obviously, a lot of what we do depends on the availability of products, and this is the focus here. UNFPA is monitoring the COVID-19 impact on family planning and reproductive health commodities, and this is very much a global effort with headquarters, regional and country offices, and constant interaction and exchanges, collaboration with national authorities, principally ministries of health, but also other relevant authorities in country, medical stores, etc., and working in ongoing collaboration with key partners and stakeholders present in countries. We're gathering data and information on stock levels of contraceptives and other essential supplies, and gauging projected risks of stockouts. That data is due to be shared in the course of next week, and on the next final slide, I will share those links with you. Proposed actions to mitigate stock out risks include collaboration on fast-track procurement for orders that are in the pipeline, and then a number of areas of liaison with the Coordinated Supply Planning Group and the Coordinated Assistance for Reproductive Health Supplies Group of the CSP and CARS. These, as many of you will know, are global collaborations. The focus here is to prioritize orders for each country to mitigate any potential stockouts. There's also a potential to consider stock transfers within a country or between countries to optimize stock management, but no decision that I'm aware of at global level has yet been taken in this particular area. Also, there's consideration of challenges with regards to in-country distribution of supplies, where there are general shutdowns in a given environment and the distribution mechanisms are blocked or very much compromised. One of the things we're considering is how to ensure supply and distribution during the crisis. Again, this is an area of discussion. I'm not clear that decisions have actually been made there. One of the things that is under consideration is the idea of financing delivery directly, which is something that typically outside of crisis environments we do not do. There are also a broad range of programmatic challenges that are being examined. Obviously, we, like many of you, are facing implementation delays in any of the plans we have. There are also practical issues such as how do we proceed with provider training and service provision in light of COVID-19 restrictions. I am ending there. I'll be happy to take questions, but on the final slide, there are links to more information, and I would strongly urge you to look there. And thank you very much for your attention. I hope it was possible to hear me clearly. Thank you.
Thank you very much, Ben. Unfortunately, I think we have had a bit of a technical difficulty with Nandita's connection. My name is Ados May. I work for the IBP Secretariat, and I'm going to turn it over to Dr. Ricky Liu from Jhpiego, who will present on behalf of Dr. Yolande Hyjazi from Jhpiego, Guinea. Ricky, please go ahead.
Yeah, thank you so much, Ados. And unfortunately, technology wasn't working with us. Dr. Yolande Hyjazi, who's based in Conakry, got kicked off because of the session was full. So she has 3 slides that she wanted to share with in this presentation. First slide, please. One is that I think the experience in during the Ebola outbreak, just we know that it has disrupted services, and including family planning services. The first slide that she shared with us was just to quantify how much of the magnitude of the disruption when it comes to providing family planning services. As you can see, that the reduction is almost like as high as 75% reduction in FP users at these facilities. The next slide, please. This slide was is also that diving a little bit deeper into the reduction is her observation that at least in Guinea, what they've observed is over the period of time that the facilities, these are like the hospitals, the larger facilities, suffered more or were impacted more when it comes to a service disruption as compared to community-based practices or services at the frontline or at the community level. Next slide, please. So here is one on an example of another level of detail in terms of where the reduction is that when it comes to contraceptive use, is that short-term methods such as condoms, oral contraceptive pills were much more less impacted as compared to services that really required a provider to insert or remove a long-acting reversible contraception. And even within this LARC provision is that the postpartum IUD as compared to interval IUD was much more affected as well. Again, in her notes is that this is also a reflection of the fact that the maternal and newborn health services were also impacted by the disruption in care. So if you can give me a second, let me just take a look at some of the notes that she shared with us in terms of the learnings. Is that for them, the learnings that that you can take away from the Ebola outbreak was that in restoring or maintaining the essential health services, one should be looking at being able to establish screening, triage, and isolation areas at the health facility level. Second is that there needs to be strengthening of infection prevention and control practices in facilities by training healthcare providers and making available essential infection prevention control supplies, particularly for those the disinfecting solutions as well as the personal protective equipment. The availability of IPC supplies is critical in order to translate those training that are already being undertaken to practice. Third lessons that they can share with us is that there need to be able to ensure basic infection prevention control practices at the community level and make available hand hygiene station at public places like markets, grocery stores, and it's critical to educate the population to respect the flow of care at the facility, starting with the screening and triaging at health facilities in order to restore community confidence in health services through effective communication campaign. This point is key for continuation and restoration of services in the epidemic situation. The last point that she raised is the following take-home messages, which is routine health services are going to be the first to be impacted during outbreaks of severe infectious diseases like the Ebola virus disease and COVID-19. Second take-home message is takes extra effort and systems approach to strengthen health facilities during and after outbreaks of severe infectious diseases, and building community and health workers' confidence by making health facilities a safer place is key to maintain and restore routine services. She thanks everyone for attention, and unfortunately, she may not be able to answer your questions right now, but we will log in the questions, and in the recording subsequent to this presentation, we should be able to put in answers to your questions. With that one, I thank the organizer on behalf of Dr. Hyjazi.
Great. Thank you, Ricky, and thank you for filling in for Dr. Hyjazi. Well, I'm going to turn it back over to you, Ricky. Ricky is the Director of Family Planning and Reproductive Health at Jhpiego, and Ricky is going to provide some reflections based on the presentations we heard, and will then also facilitate some of the questions that we've received. As a reminder, you can enter your questions in the question box on the right-hand side in the control panel. So Ricky, let me turn it over to you for some thoughts.
Yeah, so I think one is in just listening to the presentation, starting with an overview with James, moving into what's going on in Asia, and then the supply situation, as well as the insight from Yolande's presentation around the EVB. It just makes sense to be thinking about one, that in the midst of this strategic and national effort to plan an effective response to COVID-19 is the need to also highlight that there are 7 or 8 essential services that needs to be considered and acted on and become part of the plan for the strategic response. As we could see from both the presentations with IPPF and with the Ebola outbreak, it's a fact that we see the magnitude of the disruption of services across sexual and reproductive health, but particularly also in family planning and reproductive health care. Now, when we take a look at some of the questions that we are seeing in online, as well as questions that is happening right now, is this angst among both the users, the providers, as well as stakeholders around the supply of commodity, not only today at the height of the pandemic, but also in the coming months. Unlike the Ebola virus, is that the pandemic has also affected the production of active product ingredients and key materials for contraceptive commodities. And so one is trying to understand and take a look at and anticipate the interruption of production, and at the same time also being mindful that that may be in the future, but today there are barriers and issues around the resupply and access to logistics and supply for commodities that women and girls and men would use. So I think also one is that the key things to hear out from James and from Yolande is the fact that the impact of this pandemic is not only going to be felt today, but also in the coming months. And so the essentiality of maintaining and sustaining the continuity of essential care is really critical for us to preserve the gains as we move out in the post-pandemic period. So with that one, I'd like to go through the questions that have come through us. One of the first question that came up was around community-based delivery, and what and how can community-based delivery address, or the function of community-based delivery in responding to the COVID-19, and particularly for maintaining family planning services. I direct the question to James, or to Tomoko, or to Ben, if you want to respond to those questions.
So thank you very much, Ricky. And I think from my perspective, community-based delivery, as we've seen from the other presentation, one, it is less impacted. And because particularly one of the biggest challenges is the demand for services that in facilities, people find that there could be risk for infection, and therefore community members are less likely to want to go to facilities. So the community-based delivery of services is something which I think both policymakers and program managers should really consider expanding during this time because it reduces, it addresses the barriers. For example, in many of these with lockdown, the issue is that even transport sometimes is not working, or there's been no permission for people to move long distances to the communities. That would be my perspective, and maybe I hand over to it also to
Okay, Tomoko, do you want to share your thoughts on a community-based delivery?
Yeah, thank you very much. And I would like to thank you, James, for that, because I fully agree with you that community-based distributors are close to the people, and there is a fear of going to health facilities at this time during a pandemic. So there is a great potential there. In my presentation, I did say that only several percent of the CBDs have been impacted so far, but once their supplies run out, we will face the similar situation in terms of supply chains. So if these CBDs are able to replenish their commodities, I think this will be a key for them to be able to continue with their services on the ground. Thank you.
Thank you very much. If I may add as well, there's actually a great article on the role of community health workers in the time of the Ebola viral disease. And the takeaway from that article was that the fact that the community health workers, even at the height of the Ebola, continued to be present and willing to continue to provide services and link between the community and the facility. But one of the lessons learned from that was that they were engaged a little bit later than necessary, so that their ability or their ability to mitigate the impact on service disruption may have come in a bit later as compared to when they're engaged earlier. Another question that came up relates to commodity issues, Ben, and there are a couple of questions around that one, which is that given the anticipated supply issues in terms of the production and availability of these the commodities in the long term, is what can be done to coordinate and respond to the issue of commodity supply.
Thanks, Ricky. Thank you to the participants who raised this issue. I touched on it to some extent, that one of the things that UNFPA and other key partners, USAID, and many others participating in the call, in the webinar, are actively engaged in is coordination. So the country mechanisms are, the coordination mechanisms are being actively sort of drawn upon. The country supply planning, the coordinated assistance for reproductive health supplies are very much working to coordinate the supplies that are in the pipeline, and there is an effort across organizations to see who's best placed to make which products available. This is something that happens on an ongoing basis anyway, but the efforts and the need to sharpen that focus has obviously been made more necessary by the current crisis. I think we definitely are going to be faced with a situation, I imagine it's already started to happen in some circumstances, that the products that an individual would like to use may happen not to be available, very regrettably. And at that point, obviously there is orientation being shared with providers to ensure that other options are made available. This is something that unfortunately we can see may become increasingly necessary. Thank you, Ricky.
Thank you, Ben. So another related question to the commodity, aside from the production of commodity, is that within countries, particularly in the Africa region, there's a question around they're not seeing as much information around the situation in the Africa continent when it comes to commodity supply. I hope I got that question correctly read. So the question is about what's going on in Africa. Are there any specific concerns or issues or approaches that we should be considering for the Africa continent when it comes to commodity supply, as well as supply, the delivery of supply, and including family planning kits? Ben, over to you again.
Thank you, Ricky, and thanks for the question. Africa is very central to our focus, and certainly we're aware that there are constraints that mean the supply of products to the last mile to the end user is being disrupted, and it looks like that will continue to be the case for some time. In terms of specifics, we are really rolling out an effort to increase visibility on the situation for everybody. So the links that I provided at the end of the presentation link to various online resources. We can endeavour to make sure that they are shared in another way if that would possibly facilitate people to access them. But it's true that we are building a show as we speak. We have got more granular information from the stock situation in 33 lower income countries, which are predominantly in sub-Saharan Africa. As I said, next week our plan is to provide some more information about more countries to accurately capture the situation with regards to the stock situation for different contraceptive methods. I regret that it feels that we have limited visibility on this, but I would want to assure you that efforts are being made to improve that visibility. And I would really stress that that's an issue, that's an undertaking that UNFPA is very much engaged in, but it's very much a collective effort with other key partners, and obviously particularly the government in the countries in question. Thank you. Ricky?
Thanks so much, Ben. We only have less than a minute before 6:15, and I'm going to turn this over to Nandita for some thoughts. But one quick one is that questions will be answered in the recording. Nandita?
Great. Thank you, Ricky, and thank you to all the presenters. Some really fascinating presentations and excellent discussion. I think it's clear that COVID-19 has been disruptive in many aspects of our lives, not just health services, but economics and even webinars. But I do think the note that Tomoko made about the need to be agile is particularly important. And there are clearly lots of lessons learned from the Asia region and, of course, from the Ebola outbreak as well. So before we close, I just want to remind everybody that the webinar recording will be available at this link. It will also be available in the next day or two on the WHO HRP Media channel on YouTube. So you can visit Media HRP on YouTube and view the recording there. In addition, we will send all the presentations to the participants. And for more information, you can visit the IBP website, ibpnetwork.org, where you can find links to some of the documents as well as the recording of the webinar. Thank you again to all of our presenters and to the participants. Thank you for your patience, and we look forward to welcoming you again on another webinar shortly. Thank you very much. Bye-bye.
Bye. Thank you so much.